For my son, the issues started day one. As soon as he was born, he just cried all night long. I thought it would get better. I thought things would ease up over time. We were sent home from the hospital because he was completely healthy from a medical standpoint, and the crying just kept on all day, all night. I would rock him for hours on end and finally lay him down, and he would just wake up screaming minutes later. This cycle continued for weeks and weeks and weeks. Shortly after that time, he started developing illness after illness. Even minor colds would take 10 days for him to recover from. He had Coxsackie, he had RSV, he had hand, foot, and mouth disease, always with severe symptoms, always taking a long time to recover. At 4 months of age, he was hospitalized due to yet another illness, an extremely high fever around 104 degrees. He was extremely dehydrated and went through a battery of invasive tests at that time. I'm going to the pediatrician. I'm basically living at the pediatrician's office there all the time, asking her, is this normal? Should I be worried? It feels like he's sick way too often. And she reassured me that some kids just got sick more than others, and his immune system would be strong as a result in the end, and not to worry. So I wanted to believe her. I took my doctor's advice, and I hope she was right. And I just went home and dealt with the continued screaming and crying all day and all night. Around 6 months, ear infections started, and they did not stop for the next 6 months. He basically had continual ear infections that entire time and was prescribed and syringed so many rounds of antibiotics. During his first year of life, he had 20 rounds of antibiotics overall. I saw the antibiotics weren't working. They weren't clearing the infection when we went in for follow-ups. And this was something my first son had dealt with. Ear tubes really helped my first son out a lot. So I started bringing this up to the pediatrician, begging for a referral to an ENT, thinking that ear tubes would fix a lot of the problems that I was seeing in my son. She told me she couldn't give me a referral until my son had had 6 separate documented ear infections. I found out after the fact that was completely untrue, and I could have sought the advice of an ENT at any point in time on my own accord. Around 12 months of age, we finally got the ear surgery done. And by this time, we had noticed a lot of oddities in my son's development. The sickness had continued. He had developed food allergies, and he still wasn't sleeping. He was still crying all the time. He was still a miserable child. We thought the ear tubes were going to fix everything, and he would start talking, start being more engaged in the world, and we were very excited to get that done, but unfortunately, nothing got better after the ear tubes were placed. In fact, everything got worse. After his 12 months checkup, my son began really losing skills and regressing for the first time in his life. He stopped waving, he stopped looking at us. He just completely recoiled into his own world. I really started researching and learning about autism, and it became a concern for the first time. And so I went to the pediatrician and I mentioned this to her. Again, my concerns were dismissed. I was told that he was probably just not talking and he wasn't very engaged because he missed out on so much due to the frequency of illness and the ear infections during his first year. She told me he would catch up. His growth had also fallen off the charts. He was extremely small for his age, but again, she told me not to worry. He would catch up. She told me she could see autism in facial features, and my son didn't have those characteristics. And she also told me because of the way he was clinging to my neck, that didn't look like autism to her. As things perpetually declined over the next month or so, I decided, against her advice, to have him evaluated through early childhood intervention. They came in, they took a look at him, and they told me he was high risk for autism. They noted numerous developmental delays, and therapies were started right then and there. I was under the impression that we were finally getting the help that he needed. Much like with the ear tubes, I thought everything was going to start getting better. I finally have him under the care of experts who are highly familiar with autism and global developmental delays, and I thought they knew the therapies needed to offset those delays and those issues we were seeing. However, he hated therapy. It just pissed him off. It just made him angry, and he still continued to decline. That's when I really began looking into alternative treatments for autism, and dietary changes were one of the first things I came across. Because of this, I took out gluten and dairy out of his diet as a trial run just to see what would happen. And after one day of implementing these changes, he slept through the night for the first time in his life. So I had really high expectations for therapy, as I just mentioned. But the reality of it was they were basically just treating all of my son's issues as behaviors, and they were only addressing it from a behavioral standpoint. And I think that's a large part of what renders it highly ineffective. There was no mention of his slowed growth. There was no mention of the frequency of illness. There was no mention of the high fevers he was constantly having. And nothing was done to address the physiological components of his delays and his symptoms. The whole time I'm bringing all of this up to the pediatrician and asking her, what can be done? I don't feel like he's in a healthy place. And he also had constipation at this time. And she just told me again, this is what some kids experience. This is just the way it is. You're doing everything you can do, and you just need to accept this. When I took gluten and dairy out of his diet and he slept through the night for the first time, I also brought this to the attention of the pediatrician. I thought I was really onto something. She thought it was interesting, and she decided to run allergy panels for gluten and dairy. However, those panels came back negative, and she told me I needed to keep feeding him those foods because of his slowed growth. She didn't want him to lose any weight. She didn't want him to not grow anymore. So she told me I needed to keep feeding him those foods, and that the fact that he slept through the night was purely coincidental. So again, I trusted the experts, and I followed my pediatrician's advice. And so within a week of reintroducing gluten and dairy, the sleepless nights returned, the crying escalated, and again, I just trusted that the allergy tests were right, my pediatrician was right, and that was purely coincidental. Over the next 10 months, therapy continued with very little benefit whatsoever. He did finally start walking at 19 months of age, but he still wasn't talking at all. He still wasn't looking at us at all. And this is when I really knew that there had to be more to the story, and really began researching into biomedical treatment, dietary intervention, and learning all I could in those regards. Around this same time, I became pregnant, and we decided to move into a new home, so we had more space. He did fairly well with the move, to our surprise. Shortly after we moved in, though, he got his first case of strep throat. Again, with a high fever, and the pediatrician told me, it was odd to see in a kid that young, that kids 2 years old usually don't get strep throat, so she was surprised that he had it. He was treated with another round of antibiotics, and right around the time he started getting better, he had been on antibiotics for 2 days, and we had a therapy session. And during this therapy session, he was screaming and crying, as he normally did, and suddenly he ran over to the wall, and he threw his head into the wall as hard as he could. And I remember the therapist looking at me, kind of shocked and surprised, and asked me if he had ever done that, which I told her no. And she said, oh, well, he probably has a headache because he's getting over strep throat, so his head probably hurts, and this will probably self-resolve over time. Unfortunately, it did not. That was the beginning of a year of constant self-injurious behavior that escalated, both in terms of frequency and severity, and it consumed my family's life for a year. As the self-injury escalated, the therapist told me he was just trying to get my attention. They told me to ignore it when my son was throwing his head into the countertops and to try and pretend like it wasn't happening. This was the moment when I really knew that I had to take his health into my own hands, because all the people that I was told to seek for advice and expertise, nothing they were recommending provided any benefit whatsoever. And at this point, it didn't make logical sense to me. They were telling me to ignore realities that were apparent in my everyday life, and I no longer saw that as acceptable. I again took gluten out of his diet at this time, and I started giving him probiotics. Within a week, his therapists were commenting on how much more engaged he was during therapy, how much more eye contact he was making, how he was much calmer overall. And they asked me what I did. They asked me, did you change something? What have you done? Like, there was a stark difference that was not just my subjective parental viewpoint, but the therapist saw as well. So though he made these little improvements, the self-injury continued, the therapy continued, and I knew there was still more left to uncover. I joined a lot of Facebook parent groups for support at this time, and also made contact with somebody who had done the biomedical approach for their son with a lot of success. And they referred me to a functional medicine practitioner near me. I reached out to him and made an appointment, not expecting much to come from it, thinking it was likely snake oil and not rooted in reality. But I felt like I had exhausted all other options and there was nothing else I could do, and I had nothing to lose. I went to this appointment and was pleasantly surprised by the amount of scientific backing that this practitioner had supporting the methods and his approaches. He also had a son with autism. After this appointment, we were advised to remove dairy from my son's diet as well. We started several supplements, just vitamins and minerals and supportive things to help his body function properly. And we also did stool, urine, and blood testing to get a full metabolic picture of what was going on inside of him, which was a huge relief as a parent, because after you're seeing your kid, he's not healthy, he's not developing, he's clearly not feeling well, he's essentially screamed and cried through the first 2.5 years of his life, and everyone's telling you it's fine, and that's all there is to it, and this is just neurological. It gave me a lot of relief and a sense of hope. So we did those things. We took dairy out of his diet. There wasn't any, and we started giving him the supplements. There wasn't any great noticeable change immediately, but he stopped getting sick. For the first time in his life, he had a 2-month span where he had no fever, no infection, no illness. That was the first clue to me that there was something real to this. About a month after that, my son was playing on my phone, and it was a game where you would match different colored shapes up to different colored holes, and you would make the shapes match. And I heard him saying red, yellow, blue, and green. I ran over to him, thought it was too good to be true, looked at the phone, lo and behold, he was saying the right color for the appropriate shape that was on the phone. So those were his first words. And I was thrilled to hear his voice. We got the results of the blood testing around this time, and it showed dozens of low-level allergies to foods that he ate every single day. So in addition to not giving him gluten or dairy, we also removed soy, we also removed corn, and started chipping away at all the other foods that were causing allergic reactivity in his diet. We also got the results of the stool and the urine testing back. which showed that he had significant overgrowth of strep in his gut, as well as an overgrowth of yeast. Our practitioner recommended supplements to help bring these levels down and restore balance in his gastrointestinal tract. But unfortunately, anytime we would give even a drop of these supplements, all his behaviors would escalate. So even though we're seeing improvements, we're seeing speech, we're seeing cognition, we're seeing a calm demeanor for the first time, we're also seeing drastic swings to where he would seemingly lose all those skills, regress, and then the self-injury would re-enter the picture worse than ever. So it was this huge dichotomy of symptoms. This was obviously hugely disconcerting to me and made me want to quit the process many, many times. But every time I thought about doing that, I would go back in my head to the fact that he hasn't been sick. At this point, it was in 6 months. And I'm hearing my son talk, and I'm seeing progress for the first time. After years of trying, I'm actually seeing progress being made. So from other people's perspective, from family and friends, I would get a whole lot of, are you sure you want to do this? It seems like he's getting worse in some regards. It seems like this is a lot on him. But that seemed absurd to me after everything he had been through and the misery he had lived through. And I don't know why that was acceptable in that context, but not acceptable in this other context. Of course, our functional practitioner was guiding us through all of this and aware of everything that was going on. But he reassured us that as long as you're seeing any change at all, that's a good sign that you're tapping on the right nerve. And that we just needed to hone in and figure out what his body needs from an individualized standpoint. So we took his advice. We stopped all supplements many, many times. And that's what led me to really zero in on diet. That was one thing that had provided benefit from the very beginning. So that was where I started putting all of my energy. I eventually removed all of the foods that were causing allergic reactivity and any ones that I suspected could be contributing to systemic inflammation. Throughout this time, he continued to make slow, steady progress in some areas, but that was coupled with massive flares. And this pattern continued for several months, at which time I had continued researching and I first came across a condition known as PANS and PANDAS. I again brought this to the attention of my functional provider, who agreed that many of his symptoms were indicative of this condition. We decided to perform a Cunningham panel, which is another blood test that actually measures the levels of autoantibodies in the brain to quantify if neuroinflammation is present and to the degree which it is present. Those results came back within a month, and they showed elevations of 2 antibodies and a borderline elevation of a 3rd, resulting in an official diagnosis of PANS and PANDAS, which essentially translates to autoimmune encephalitis, which essentially translates to swelling in the brain, which obviously affects many behaviors and can contribute to many of the symptoms that we were seeing in my son. My practitioner recommended that I adopt the specific carbohydrate diet, also known as SCD, which I had all but done. There were only 2 foods left that he was getting outside of that diet. So we implemented that diet right around his 3rd birthday. And shortly before that time, we also introduced Camel's milk. Camel's milk was a life-changing experience. That was one of the only things I ever did throughout this entire journey that provided undeniable, massive benefit right from the start. We started only with an ounce. I'm gonna make another video on Camel's milk in the future. There's a lot to this. There's a lot of science behind why it works, and I don't have time to get into that now. but I will. So if you're interested in that, keep your eyes out, because that video is coming in the near future. But we started with a small amount because this does have medicinal properties. It is very strong. We gave him an ounce. That day, the self-injury stopped. The things that would typically make him melt down throughout the day, which we knew and we were prepared to handle. For instance, I remember turning off the water in the bath. That always caused a massive meltdown. I remember that night turning off the water and we're gearing up for the self-injury and we're waiting for it to happen, and he just smiled and looked at the water dripping out of the faucet. He noticed airplanes in the sky for the first time in his life that day. He was actually scared of them, like, what is that, you know? But he had never, ever even noticed an airplane or a bird or anything like that in the sky. He gave me his first hug that day, and his entire disposition opened up. He had this light in his eyes that we had never, ever seen before. Yeah, it was a magical day. I urge you all to look into camel's milk, and I look forward to giving you more information about that. We couldn't believe it. You know, it felt too good to be true. Within a month of starting the camel's milk, we went and visited family, and none of my family members could believe the change that had occurred in my son. They were all asking what I had done. They were patting me on the back, and they were saying, whatever you're doing is working, and keep doing it. And that was when a real shift happened in the response I got from people who were outside of our everyday situation. Apparently seeing is believing. And this just was really affirming to me and huge motivation to keep going. And at this point, there was no doubt in my mind that what we were doing was beneficial for my son and that we were on the right track. We thought it was going to be home free from there. But unfortunately, 4 months or so after starting the camel's milk, my son started having severe asthma attacks. Literally out of nowhere, one night we just heard an odd noise on the baby monitor. And when we went up to check on him, he couldn't breathe. At the same time, we had been seeing odd symptoms starting in our other children and in ourselves as well. Things like rashes, nosebleeds, chronic headaches, severe fatigue, all these kind of unnameable symptoms that we couldn't place. And my son kept having the asthma attacks to the point we were in the ER once every couple of weeks. And they ended up telling us, your kid has asthma. They gave us a prescription for albuterol so we could just administer breathing treatments at home without having to go to the ER. This was perplexing to us because he had been doing so well. It ended up about 2 months after the initial asthma attack, we discovered toxic mold growth in the HVAC system of our home, which led to discovery of mold in many more areas. And this is another thing, I can't go into a lot of detail right now. Another video is coming specific to mold. I know so many people out there are concerned about it in the autism community. So many people are dealing with symptoms. It's next to impossible to avoid exposure. And so this is a huge component of overall health. After finding this mold, we tried to remediate several times. The remediations were not successful. Every time we would leave the house, the asthma attacks would stop. Everyone's symptoms would get better. We thought it was clean. We would try to move back in. All the symptoms would escalate. Everything was right back to where it was. My kid's back to having asthma attacks. Eventually, and I don't recommend this for most people who have mold issues, usually you can fix it and remediate it to a point where it's safe. We weren't able to. So we ended up leaving the home, which was a huge decision and caused a lot of skepticism to resurface in friends and family. Our house was newly built within the past 2 years at this time. So it seemed unthinkable that there could be mold growth severe enough to cause these kinds of symptoms. After leaving that house, that was the turning point. My son took off from that point forward. The asthma attacks completely stopped. The nosebleeds completely stopped. I kept on with the nutrition. That was always the foundational cornerstone that allowed for all of his development to take root from my perspective. Now, that's just continued. And it's been a slow, steady thing over time. A lot of people expect drastic overnight results. The only time we got that was with camel's milk, and that's extremely rare. I think sustained, gentle progress over time is what you want to see. But that's what my son has experienced. Now, today, he's in 3rd grade. He's in school right now down the street in a mainstream classroom. He's making friends. He's gone from completely nonverbal at 2.5 to fully conversational. He has a great sense of humor. He doesn't have meltdowns at all anymore. He has the most happy, loving disposition you could imagine. He's very close with his younger brother. He's extremely close with his older brother. He has friends at school. He is able to do all of his schoolwork on his own. And he's just thriving in every regard. He's a happy, healthy kid. And looking back, if I had listened to all the therapists and all the doctors and all the experts along the way who told me he was never going to talk, who told me I would be changing his diapers for the rest of his life, who told me I needed to prepare for the fact that my kid would likely be institutionalized, if I had just accepted that as they told me to accept it, my kid would not be where he is today. So that's our story. It took years and years of dedication and heartache and battling with hopelessness to get here, but I'm so glad I did. If I could go back now and do things different from the beginning, I would have avoided artificial foods, food dyes, MSG, gluten and dairy in his diet from a much earlier age. I would have focused on giving him whole, nutrient-dense foods. If I could go back, I would also not take every expert's advice at face value. I would explore every option I could and research as much as I could at a much earlier time frame. I wouldn't have just resolved to the comforting thought that therapy is going to fix all of this. Therapy is beneficial for a lot of kids, but it was not for mine. We quit therapy when he was 3 years old, so all of his progress just purely came from improving his physiological health. If I could go back, I would pose all the questions that were in my head to the doctors. I wouldn't have felt inferior and like just a mom, a delusional mom. I wouldn't have believed all those things people were saying about me, and I would have questioned them. I would have asked them for their research. I would have asked them how changing what my kid eats is going to be a detriment to him. I would have advocated for him a lot more fiercely had I known everything I know now. So never forget that. Nobody knows your kid like you know your kid. Nobody can understand the gravity of your situation if they're not there living in it on a day-to-day basis. So use that knowledge and educate yourself and learn all you can and do what you need to do for your kid, regardless of what anybody tells you.
Period.
There's more support on our website. You can find the link on the video. And yeah, we're going to offer more and more resources over time, and we're really excited to do that. So thanks for watching, and we'll look forward to more.